We can all agree one of the most important jobs is being a teacher, which means that as an administrator, taking care of your teachers is one of your top priorities. My name's John. I'm a subject matter expert over here at Remodel Health, and we help employers take better care of their employees by cutting costs and getting them better healthcare coverage. Today, we're going to talk about better healthcare options for K-12 schools. To get us started in this conversation of better healthcare options for K-12 schools, let's talk about options. Oftentimes, the employer simply goes and finds one insurance product, puts all their money behind it, then offers it to their team. Their team can take it or leave it, and if they're going to put money into it, it's attached to one product. That's not options, but there's something better out there. And over the past decade, a new model called managed individual has become available, and every single individual can find an individual product that fits them best. For example, if somebody really wants to save up money, they might not use healthcare a lot, and they want to make sure they're thinking about the future and get into an HSA plan, a health savings account plan. Those are very popular for certain people, maybe not a one-size-fits-all, but it could really help them to be satisfied. What about offering a Christian product, a faith-based product that someone on your team can actually pick a product for something that their faith aligns with? This would be an incredible selection for that individual. Or what if there's someone who actually has a spouse's plan available, but for so long they've been on two different plans and two different deductibles? What about having them join the same plan and being able to have the same deductible? You will lower the exposure on that individual because it's an individual plan and you want to manage them all together and actually give them options for the first time instead of that one size never fits all group plan. The next thing we have to talk about for better healthcare options for K-12 schools is that better is cheaper. And you heard me right. I know that we all want to spend the least and get the most. It's good business. But in the back of our minds, don't we always worry that by cutting the cost, we're just cutting the coverage, making the plan worse, and then completely defeating the purpose of taking better care of our teachers? Yeah, that's a great point. But what if I told you that those old, outdated, overpriced group plans were missing a key feature that individual insurance products have? When you manage all those individual products together, you unlock something called tax credit discounts on the individual product. These are similar to child tax credits. If you have a child, you get a tax credit. If you have an individual insurance product, you can get a tax credit that discounts it, and by managing it all together, you unlock that savings. But what's the big deal about these discounts? Well, the big deal is that they're big discounts. In fact, on average in 2022, 68.5% discounted off the cost of the product. And you want to know the dollar amount of that? The dollar amount is $562 a month in savings. On average, this is $6,744 a year savings on this plan. So are you starting to see that cheaper is definitely better when it comes to finding healthcare options for your school? The last thing for us to talk about for better healthcare options for K-12 schools is making it better. And the way you can do this is through medical dollars. Medical dollars. You may not know this, but the national average for the max out of pocket on an insurance plan is $8,078 a year. That means on average, if your employee does not have $8,000 in cash when they have their worst medical year, they're going to go into medical debt. The legal limit on the max out of pocket is actually $17,400. This means that when a bad year happens, your team needs medical dollars to pay for the medical bills when they happen. And thankfully, as you saw in point number 2, there is a lot of savings to be had from getting into managed individual products and unlocking those tax credit discounts. The reality is you can strategize using a health reimbursement arrangement or health savings account dollars, lots of strategic ways to prevent your team from having to go into medical debt when they have medical bills. And this is the way to truly make better healthcare options for K-12 school. Now, I know that I just gave you a lot of information in a very short amount of time. which is exactly why I would love to invite you to keep learning on one of my free educational webinars. You can register right now at remodelhealth.com/webinar. I do these regularly just as a step for you, risk-free, to learn more about the way that old outdated group plans are leaving, the way pension plans did in the 1980s. They're being replaced, similarly to the way 401ks came on the scene in this managed individual way, to make it so that you can increase options, you can get cheaper plans, and ultimately start giving a better healthcare option to your K-12 school. Again, go to remodelhealth.com/webinar. Start learning today. It makes total sense that someone from a school would want to learn, and I'm looking forward to helping you and everyone continue to walk into the future of health benefits.